Hey guys, this is Dr. Hub. Today we are looking at the congenital coxa vera. So how does the patient present with? So mainly it involves children, and they start walking with a shortening of the limb. So they experience shortening of limb, and there's limitation of the abduction. So there is a limitation of the abduction. Then comes the internal rotation. Then there is also the IR, that is the internal rotation. So this is indicative of the case of the congenital coxa vera. So all this is indicative of the congenital coxa vera. So in this case, what are the angles? So in the congenital coxa vera, the angle formed between the head of the femur and the shaft. So when you look at the head of the femur and the shaft, so head of femur and the shaft. So this angle is decreased less than 120. So this angle, if you see, it will be decreased less than 120. So this angle is known as from the angle formed between the head and the neck of the femur. Head and the neck of the femur. This angle is nothing but the Mikulicz angle. The Mikulicz angle. To learn and grow daily like this, please do subscribe.